Healthcare Center Clinic and the Linyanti Clinic were inaugurated on the 31st of October 2024 by Dr. Kalumbi Shangula, who is the Minister of Health and Social Services in the Zambezi region. Now, the construction of the clinic is aimed at ensuring that patients do not walk long distances to access healthcare services. Now, the Linyanti Health Center was constructed at a cost over 17 million, while the Malengalenga was built at just over 14 million and will be equipped with modern medical equipment, skilled healthcare professionals, delivery room, kitchen, and waiting area, amongst others. Now, joining us with more is the Public Relations Officer, Control Public Relations Officer from the Ministry of Health and Social Services, Walter Kamaya. Good morning, sir, and welcome to Good Morning Namibia.
Good morning to you too. Thank you.
Okay. Now, Walter, give us an insight of what exactly these two facilities represent in terms of the health sector, and is this part of the overall goal of the ministry in bringing services closer to the people?
Yes, thank you very much. I think what the ministry is doing, we are just trying to fulfill our mandate. If you have, we have listened to the cries of the community, we have reached out to our community, we have realized that it ought to be specific in the Malengalenga and Linyanti. The Malengalenga clinic or the Malengalenga community people, they were troubled or they faced difficulty to access healthcare services. Like the nearest clinic where they could go when the need arise, which is 35 kilometers away from them. So the nearest clinic, it is stationed, it's built at Shangula. Well, the other side is built at Batubaja. So from Malengalenga to that area, it's almost about 35 kilometers. So indeed, these people faced difficulties in their lives to access healthcare services. Sometimes, if they need healthcare services during nighttime, they have to navigate, they have to face danger of these predators that can end their lives. So this was the idea to say to it that they should access these services at their doorsteps.
Okay. Now, reducing the 35 kilometers is quite a long distance, and bringing them closer to the people. Talk about some of the challenges that the ministry is facing, including, those people in those communities. Besides, bringing the clinic much closer. What were some of their challenges in relation to health matters?
Thank you very much. The challenge that the ministry is facing, not only at Malengalenga, but in general, what sometimes if the ministry has a plan to build or to set up a structure, the biggest challenge that we face is the allocation of land. So I remember, for Malengalenga to be specific, the governor himself has to go there, with the councillor have to go there, just to lobby for land, to ask for people to avail land. Sometimes you discover that land can be allocated, but after all you find somebody will come and challenge, no, that land belongs to me, that land belongs to this one. So it's a hassle that we need to convince people to allocate land because of the history background based on that land. Sometimes when you look at it, it's an open space. The other issue that the ministry is facing, sometimes when it's very rare that when we start a construction with a certain contractor, that contractor ends up the contract. In some cases, you discover that we will be left without any choice but to end up the contract. So some of the contractors that we do hire, in the end, they turn up to disappoint the ministry in terms of delivering on time. Because mostly when we enter into these projects, we anticipate that at what time should this facility be completed so that it should be commissioned into service. So it's the same thing with the Malengalenga clinic. Last but not least, we all know that the challenge of financial resources can also kick in. But however, sometimes when we do these projects, we look into those things, and then of course there's a budget.
Are you happy with the contract that we've appointed to deliver in terms of these two clinics?
For Malengalenga, there was a time when the clinic was abandoned. So the community members had to reach out to the ministry, they had to cry. So the Honorable Minister in 2019 went there, we had to listen to them. The traditional authority had to write letters. So the minister decided, oh no, we are going to take the step forward. So the first contractor did not complete the building, so the contract had to be terminated. So a new contractor has to be hired to finish up, and then if we understand the process of procurement, so it changes also the cost from the initial one that was planned. So, but with the one that completed, yes, we are happy. All the specifications were made according to the agreement.
Okay. Now, we understand that the ministry, the government through the ministry is currently implementing a costed plan to address the identified shortcomings in the public sector. Are you able to highlight on some of these shortcomings? What are these shortcomings?
Yes, the shortcomings, the ministry looked at projects that could strengthen the health system. So the shortcomings is that the ministry does not, or the ministry do not have much resources to do renovation, to do construction, to upgrade facilities. So the ministry set up, costed up the projects that the ministry have deemed fit that if these projects are implemented, the healthcare system could be improved. And then this is the plan that was taken to cabinet and was approved in terms of resources allocation. So this basically looks at the strengthening of the public health system as far as renovation of the existing structure is concerned, constructing new buildings or new structures, as well as upgrading of our facilities just to reduce the long walking distances from this community to this community. So basically that's what we refer to as the costed plan.
Okay. Let's talk about, in building to some of the shortcomings that you've highlighted, be it obviously the issue of land, be it the issue of resource allocation and non-performing contractors. How is the ministry, though, trying to improve and strengthen the public systems to attend to the needs for the future? We saw that during COVID-19, we were lacking adequate bed capacity for ICUs. So overall, what are we doing to try and to ensure that moving forward, whatever situation or circumstance comes up, we are strengthened in terms of the health sector and that we are well prepared?
Yes, I used to tell people that there's what we call capacity. Yes, like if we have an ICU, if the capacity of that particular ICU, it takes 15 beds, we'll discover that what we usually go through as a ministry, sometimes you can get what we refer to as more than the capacity. And then if we look at the building, it's something that you cannot extend overnight. But however, during COVID, the ministry has embarked on a project of strengthening and increasing more bed capacity in ICUs. There are some ICUs that have been inaugurated in almost in each and every region, just to see to it that we are better than yesterday, we are better than last year, just to try and improve. What I usually used to tell people is that when it comes to health system, yes, there are challenges here and there that we strive to improve on a daily basis. But we discover that sometimes the demand that we receive on a particular day, it's more than what we can absorb. So, and then it's difficult for us to react. But what we used to advise people is that if people have the health-seeking behavior, if they have this behavior of seeking for healthcare services, we will definitely be able to improvise to attend to them, unlike whereby we can refer people to their homes. We cannot tell people that we don't have the capacity, we cannot attend to you, we cannot handle you, cannot handle you. We'll try by all means. If you look at some other places, we have erected tents when the demand was high. Instead of folding our hands and waiting for permanent structures, we have fabricated structures that are easy to complete and so forth. All these things are provisions to be able to attend to the needs of our population.
Okay. Now, as we begin to wrap up our conversation this morning, let's talk about the policy of universal health care. What does this policy entail, and what does it mean? And if implemented, how does Namibia benefit from this policy?
Thank you very much. How Namibia will benefit if this policy is implemented? The universal health care coverage, we are talking about no one should die because of they don't have medical aid. If you discover now, you will see that more than 85% of our population do depend on the government facilities. What about other 15%, where do they go? So they go to private sector. So the universal health coverage is just an initiative, an idea to see to it that each and every person should have access to health care services without looking at their status, without looking at their background, without looking at their educational level, and so forth. It's just, the ministry is just trying to reach out to everyone. Also to see to it that the health services are rolled out to all corners of Namibia for Namibians and others.
Now, as we conclude our conversation this morning, do we expect any more groundbreaking in terms of clinic? Are there currently projects that are underway that are almost completed?
Yes, there are a lot of clinics which are underway. We talk of, I think this month in November, we will inaugurate another one in Andara. You know, as long as the population keeps growing, the health system also should try to grow and respond to the need on the ground. So yes, we'll keep doing that as soon as there's a place and then there's an assessment being done and then there's a need identified that these people do need a new facility based on the reasons given, the distance that they are traveling, lack of transport and so forth. The ministry definitely will continue to do through the costed plan that we have discussed about earlier.
Okay. Well, Mr. Walter Kamaya, thank you very much for making time to speak to us this morning.
Thank you for having me. It's my pleasure.
Okay. Now, that was Walter Kamaya, who is a Control Public Relations Officer at the Ministry of Health and Social Services, talking to us about the Malengalenga Primary